Did you know that chiropractic care can help posterior tibial tendonitis? That's a type of shin splints, and we're going to demonstrate how we manage that here in the office. Michael's here with us now, and he's a marathon runner, been running most of his adult life, over 10 marathons, and recently he found he was getting a little bit of calf pain during his marathon. It was a real hot day, and he's trying to stay hydrated, been doing all of his trainings, but he figured, it's a little sore, I'll continue to run through it. Well, he finished the race, and the calf stayed sore. Lightened up on his running for a few weeks, and his calf stayed sore. He found ballistic activities, jumping, pushing off was really painful, and at that point it got to, well, I need to do something. So he came in, and we examined him. We gave him a thorough examination, and we found that it was one specific calf muscle which had tightened up and had knotted, become a little bit of fibrotic, some tightness in there, and it turned out to be his posterior tibial muscle. And we have a little heat on his calf now because that's the first step in treating it. But the posterior tibial muscle just runs right back behind the shin. A lot of people would call it like a posterior shin splint. But in this case, it was a strained muscle that had become stiff and tight. So we came up with an accurate diagnosis, pinpointed his problem, we muscle tested it, it gave him pain, so we knew that was the issue. So how do we treat this? Well, first we put a little heat on it to relax it. Then we put some skin lubricant over the area, and we're going to use a procedure called Grafton, where we take a stainless steel tool and we loosen up the tightness in the scar tissue. So a little lubricant over the skin, and we use the stainless steel tools just to break down those pockets of scar tissue. In the calf, there's lots of different muscles that are involved, but we want to screen the whole area. We're going to really hit this inside part, and as Michael's been doing better, we've also found he had some tightness through here, which has been residual. Treatment time is really not that long. We can use a broader base stroke just to get the blood circulating. Now, if you notice, he's getting a little redder than it was a moment ago. That's because the Grafton does create redness. When we get in there really deep, it'll also sometimes create little pockets of bruising. This is the first stage with the Grafton. The next way we'll do it with the Grafton is we'll have him weight bearing and loading the muscle while we're doing it. That helps to break down some of the even deeper scar tissue. Now we're going to get in with a different instrument right up and through here. That's the muscle itself. And beyond that, we even do functional movement patterns sometimes, where we put the athlete or patient right through their specific movement patterns while we're doing the Grafton. The bottom line is we need to break down the scar tissue between the individual muscles, as well as the scar tissue within the muscle fibers of the belly of the muscle itself. Drives blood to the area, loosens up the scar tissue, restores flexibility. Then we can turn around and rehab it properly. Then we had Michael doing some corrective exercises for the posterior tibial muscle specifically, and we get him back running. It's a very effective way of treating it. We're going to give you just a few more minutes of Grafton, then we're going to demonstrate weight bearing and his posterior tibial exercises, and then you'll know that chiropractic care works really well for posterior tibial tendonitis. So with this approach, we're actually loading the soleus and posterior tibial muscles nicely while we're doing the Grafton. Very aggressive, but very, very effective. When there's inflammation, we generally don't do this. This is in the subacute phase of treatment. And then it gives us the ability to really get to those deeper muscles in a functional movement pattern. Posterior tibial muscle runs back through here and underneath the bottom of the arch. So to strengthen that, you can go up onto your toes, but then you also want to kick the heels in just a little bit, derotate the heels, and drop down. Bring up onto your toes, weight on the big toe, curl in, straighten, and go down. That works the posterior tibial muscle, clearance of the hamstrings into the butt. Great way to strengthen them. Real slow on the way down. Start with 2 feet like this, then we progress to doing them off the stair, then we progress to doing just 1 foot at a time. So that's the integrated approach for treating posterior tibial tendonitis in the runner with chiropractic care. Of course, we're adjusting his lower back, hip, and knee to make sure his mechanics are good. With Grafton therapy, corrective exercises. Now you know posterior tibial tendonitis responds great to the procedures we use in the office. I'm Dr. Donald DeFabio.